This video is for educational and informational purposes only. It is not intended to replace professional medical advice, diagnosis, or treatment. Always consult your physician or qualified health provider regarding any medical condition or health concerns. Coronary artery disease, CAD. Did you know that the first sign of heart disease in many people is sudden death? Coronary artery disease doesn't always warn you. Could your heart be at risk right now without you knowing? Coronary artery disease, CAD, remains the leading cause of death worldwide, claiming millions of lives each year. What makes this condition particularly dangerous is its often silent progression, advancing over years without symptoms until a life-threatening event such as a heart attack strikes. Early awareness, timely diagnosis, and proper management are essential to prevent disastrous outcomes. The introduction. Have you ever wondered why someone seemingly healthy suddenly collapses from a heart attack? Behind this tragic moment often lies a hidden enemy, coronary artery disease. It's called the silent killer for a reason, striking without clear warnings for many until it's too late. But what exactly is this condition? Coronary artery disease, CAD, also known as ischemic heart disease, is a condition characterized by narrowing or blockage of the coronary arteries due to atherosclerosis. These arteries supply oxygen-rich blood to the heart muscle. When their lumen narrows, the heart muscle receives less oxygen, impairing its function. CAD is a chronic process that can lead to angina, myocardial infarction, heart attack, heart failure, and sudden cardiac death if not appropriately managed. Signs of coronary artery disease. What if your body was giving you small warnings, but you just didn't recognize them? Breathlessness on the stairs, swelling in your ankles, fatigue at the end of the day. Simple signs that could mean something much more serious than just aging. But what are these signs really telling you? 1. Chest discomfort, angina pectoris. O, typically described as tightness, pressure, heaviness, or squeezing in the chest. O may radiate to the shoulders, arms, especially the left, neck, jaw, or back. 2. Shortness of breath, dyspnea. O, especially during physical exertion or stress due to reduced oxygen supply to the heart muscle. 3. Fatigue. O, unusual tiredness or reduced exercise tolerance, sometimes the only sign, especially in women and elderly patients. 4. Palpitations. O, irregular or rapid heartbeats due to reduced coronary blood flow affecting heart rhythm. 5. Dizziness or lightheadedness. O, caused by inadequate cardiac output from the heart due to impaired function. 6. Sweating, diaphoresis. O, excessive, unexplained sweating, often accompanying chest pain or discomfort. 7. Nausea or indigestion-like sensation. O, some patients, especially women, may report abdominal discomfort, nausea, or a feeling similar to heartburn. 8. Peripheral edema, swelling in legs/ankles. O, may occur in advanced cases when heart function is significantly impaired, associated with heart failure. Causes of coronary artery disease. Could the meals you love or the stress you ignore today become tomorrow's heart problem? Many causes of coronary artery disease start silently, with everyday choices building up over time. But what exactly triggers this life-threatening condition? The principal cause of CAD is atherosclerosis, a process wherein fatty deposits, plaques, accumulate within the arterial walls. This buildup progressively narrows the arteries, restricting blood flow. Risk factors contributing to atherosclerosis include modifiable causes. 1. Smoking. Tobacco use damages the inner lining of arteries, endothelium, promotes plaque buildup, increases blood clotting, and reduces oxygen delivery to the heart. 2. Hypertension, high blood pressure. Chronic high pressure in arteries damages vessel walls, making them more prone to plaque formation and narrowing. 3. Hyperlipidemia, high LDL cholesterol, low HDL cholesterol. Elevated LDL, bad cholesterol, contributes to fatty plaque buildup in artery walls, while low HDL, good cholesterol, reduces the body's ability to remove these deposits. 4. Diabetes mellitus. High blood glucose levels accelerate atherosclerosis by promoting inflammation and damage to blood vessels. 5. Obesity. Excess body weight is linked to abnormal lipid levels, insulin resistance, hypertension, and inflammation, all of which increase CAD risk. 6. Sedentary lifestyle. Lack of regular physical activity contributes to obesity, high blood pressure, poor cholesterol levels, and impaired glucose metabolism. 7. Poor dietary habits. Diets high in saturated fats, trans fats, cholesterol, salt, and sugar promote atherosclerosis, hypertension, and diabetes. 8. Chronic stress. Long-term stress raises cortisol levels, blood pressure, and unhealthy coping behaviors, such as overeating or smoking, which can damage arteries over time. Non-modifiable causes. 1. Age. Risk increases with age, as arteries naturally stiffen and accumulate plaque over time. 2. Male gender. Men generally develop CAD earlier than women, though postmenopausal women face similar risk due to declining estrogen protection. 3. Family history of premature CAD. Genetic predisposition can influence cholesterol metabolism, blood pressure regulation, and other factors contributing to early-onset CAD. Symptoms of coronary artery disease. What if chest pain isn't the only sign your heart is in trouble? Did you know that nausea, jaw pain, or even tiredness could signal a heart condition? These hidden symptoms are often dismissed, but they could save your life if recognized early. What should you watch for? In its early stages, CAD may be asymptomatic. As the disease progresses, symptoms may include angina pectoris, chest pain or discomfort, typically triggered by exertion or stress and relieved by rest or nitroglycerin. A shortness of breath, dyspnea, especially during physical activity. A fatigue, generalized tiredness or reduced exercise tolerance. A palpitations, sensation of irregular or rapid heartbeat. A symptoms of acute coronary syndrome, ACS, e.g., myocardial infarction. Severe chest pain not relieved by rest, radiating to the arm, neck, or jaw, sweating, nausea, dizziness, fainting. Diagnosis of coronary artery disease. How can doctors detect a silent killer like coronary artery disease before it strikes? From stress tests to advanced imaging, the medical world has tools to uncover hidden dangers inside your arteries. But which tests are essential for early detection? A thorough evaluation is essential and typically includes 1. Clinical assessment. A history taking, evaluating risk factors, e.g., smoking, diabetes, symptoms like chest pain, and family history. Physical examination. Checking for signs such as high blood pressure, abnormal heart sounds, or signs of heart failure. 2. Non-invasive tests. A resting electrocardiogram, ECG, records the heart's electrical activity, can detect previous heart attacks, arrhythmias, or signs of poor blood supply. A stress testing, exercise, or pharmacological, assesses the heart's function under physical stress, treadmill, or chemical stress, with drugs like dobutamine. Helps detect reduced blood flow, ischemia. Echocardiography, including stress echo, uses ultrasound to visualize heart structure and function. A stress echo can show areas with poor blood supply when the heart is stressed. A coronary CT angiography, CCTA, a special CT scan that visualizes coronary artery anatomy and detects blockages or plaque buildup without invasive procedures. 3. Invasive testing. A coronary angiography, the gold standard, involves injecting contrast dye into coronary arteries through a catheter to directly visualize blockages on X-ray imaging. 4. Laboratory investigations. A lipid profile measures total cholesterol, LDL, bad cholesterol, HDL, good cholesterol, and triglycerides to assess atherosclerosis risk. A blood glucose levels, HbA1c, identifies diabetes or prediabetes, both of which significantly raise CAD risk. A high-sensitivity C-reactive protein, HSCRP, marker of systemic inflammation that may indicate higher cardiovascular risk. A cardiac biomarkers, troponins, proteins released into the blood when the heart muscle is damaged, used to confirm or rule out a heart attack, especially in acute coronary syndrome. Treatment plan for coronary artery disease. If you were diagnosed today, what would the path to recovery look like? The good news is, coronary artery disease is manageable with the right treatment plan, from medications to surgery. But what are the options that could save a life? 1. Lifestyle modification. The foundation of CAD treatment aimed at controlling risk factors and preventing disease progression. A smoking cessation. Eliminating tobacco use halts further damage to blood vessels. A heart-healthy diet. Reducing saturated fat, trans fat, salt, and sugar intake helps lower cholesterol and blood pressure. Physical activity. Regular exercise improves cardiovascular fitness, weight control, and insulin sensitivity. A weight management. Reducing excess body weight lowers the risk of diabetes, hypertension, and high cholesterol. A stress reduction. Techniques like relaxation therapy, meditation, and counseling can decrease harmful stress effects on the heart. 2. Pharmacological therapy. Medications to control symptoms, reduce disease progression, and prevent complications. Antiplatelet agents, e.g., aspirin, clopidogrel prevent blood clots in narrowed arteries. Statins, lower LDL cholesterol and stabilize plaque, reducing the risk of heart attacks. Beta blockers, reduce heart rate and workload, relieving angina and lowering blood pressure. ACE inhibitors/ARBs, lower blood pressure, improve heart function, and offer protection, especially in diabetic or heart failure patients. Nitrates, dilate coronary arteries to relieve chest pain, angina. Calcium channel blockers, relax blood vessels and reduce heart workload, especially if beta blockers can't be used. SGLT2 inhibitors/GLP-1 receptor agonists, used in diabetics to improve heart and kidney outcomes. 3. Revascularization procedures. Interventions to restore adequate blood flow in significantly blocked arteries. Percutaneous coronary intervention, PCI, a catheter-based procedure, angioplasty, with stent placement to open narrowed arteries. A coronary artery bypass grafting, CABG, surgical creation of new pathways for blood to reach the heart muscle, bypassing blocked arteries. The implementation. But how do you turn treatment into action? Changing lifelong habits isn't easy, but every step counts. From what you eat to how you move, these choices decide your heart's future. How can treatment plans turn into real daily improvements? A multidisciplinary approach involving cardiologists, dietitians, physiotherapists, psychologists, and primary care physicians is critical. Patient education on medication adherence, symptom recognition, and emergency response is emphasized. Shared decision-making ensures that treatment aligns with patient values and preferences. Monitoring and follow-up. Is the battle over after treatment? Not quite. Coronary artery disease requires regular checkups and careful monitoring to prevent its return. How can consistent follow-up protect your heart in the long run? Ongoing follow-up is necessary to assess disease progression and prevent complications. Routine visits every 3 to 6 months, or as clinically indicated. A monitoring of lipid profile, blood pressure, and glycemic control. A periodic stress testing or imaging to assess for new ischemia if symptoms change. The evaluation of medication adherence and side effects. A lifestyle counseling reinforcement. Patients with stents or CABG require lifelong antiplatelet therapy and periodic cardiac assessment. Prevention for coronary artery disease. What if you could stop coronary artery disease before it ever begins? Prevention is the most powerful treatment of all, from smart food choices to regular exercise. But what simple steps today can keep your heart safe tomorrow? 1. Lifestyle modifications. A smoking cessation. Complete avoidance of tobacco products prevents further vascular damage and lowers CAD risk substantially. Healthy diet. Adoption of a heart-friendly diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, like omega-3, helps maintain optimal cholesterol and blood pressure levels. A regular physical activity. At least 150 minutes of moderate aerobic exercise per week, e.g., brisk walking, cycling, improves cardiovascular health, weight control, and insulin sensitivity. A weight management. Maintaining a healthy body weight, BMI 18.5 to 24.9, reduces the risk of hypertension, diabetes, and dyslipidemia. A stress management. Practicing relaxation techniques, meditation, or engaging in hobbies reduces stress-related hormonal effects on the heart. 2. Control of medical risk factors. A blood pressure control. Keeping blood pressure below recommended targets, usually 130/80 mmHg, reduces artery damage. Cholesterol management. Maintaining low LDL and high HDL cholesterol through diet, exercise, and medication, if needed, prevents plaque buildup. Diabetes management. Tight glycemic control, HbA1c less than 7%, lowers the risk of vascular complications. 3. Medication, when indicated. The prophylactic use of statins, antiplatelet agents, e.g., aspirin, or antihypertensives in high-risk individuals helps prevent disease progression. 4. Regular health screenings. A periodic monitoring of blood pressure, cholesterol, and glucose levels aids in early detection and timely intervention of risk factors. 5. Education and counseling. A patient education on CAD risk factors and prevention methods empowers individuals to make informed health choices. Coronary artery disease is largely preventable and manageable with early detection and appropriate intervention. As healthcare professionals, it is our duty to educate, motivate, and empower patients to take control of their cardiovascular health. For individuals, regular health checkups, risk assessment, and a heart-healthy lifestyle can make the difference between life and premature death. Do not wait for symptoms to act. Proactive heart care saves lives. Schedule your cardiovascular evaluation today. If you found this video helpful, don't forget to hit the like button to support the channel. Make sure to subscribe and turn on the notification bell so you never miss valuable health insights like this. And we'd love to hear from you. Drop a comment below sharing your thoughts or questions about heart health. Your feedback helps us create better, more informative content just for you.